I'm Dr. Adewale Troutman. Colon cancer is a deadly killer. To prevent it, you got to get screened. As a public health professional, the awareness that colorectal cancer is a very highly preventable and certainly treatable disease, that if we just did the right thing, we could save probably tens of thousands of lives throughout this country. No health insurance keeps you out of the system, at least until you are so far gone that you are now, it's unlikely you're going to get a cure, and you're going to have a much shorter life expectancy from whatever the particular condition is. Recommended age for screening is 50. For African Americans, it's lower. It's actually age 45. Access remains a significant issue. That is to say that you can have insurance, but if you can't get to a good primary care physician as easily as somebody else can, because there's nobody in your neighborhood, because you're so poor, you have to take 3 buses to get to a clinic somewhere that may close at 5 o'clock, we still don't have equal access. So we have to have insurance coverage and we have to have equal access. The question of why people don't come in to get screened earlier may partially be related to a sense of fatalism. Well, first of all, there's this notion that if I don't have any symptoms, there's nothing wrong with me. And the whole idea of prevention is to define a condition that does not yet manifest itself by symptoms. Because the nature of colorectal screening, which is a colonoscopy, there are a lot of people out there who are not particularly interested in having the procedure itself done. They have all kinds of ideas about what this procedure is going to be, and tend to want to stay away from it. And that's part of the challenge that we have in this business, is getting people to understand that this is, it's no big deal, and it very well may save your life by determining that you've got something that's treatable early on, before it turns into a full-fledged cancer. Yeah, as to the question of how you provide opportunities for people to get screened who don't have health insurance, first of all, it requires you to be creative. It also requires that you have usually some champion, some local champion, who's going to bring this issue to the fore. In the context of this community, it's been Whitney Jones, who has taken this on as a kind of a national or at least a statewide crusade, but looking at national models like New York City. It's fantastic when you can get practitioners and hospitals and healthcare systems to volunteer free services to people who need them. But I've always said, if we're in a situation where we have to depend upon healthcare systems to volunteer to provide services to people, we're in trouble.